So now I'm going to do the segment 4 lower extremities assessment. So throughout the leg assessment, note the leg active range of motion, muscle mass, and strength. So to assess the vascular system, inspect the patient's leg, observe their skin color and condition, hair distribution, and toenail integrity. So look for abnormalities such as asymmetry, venous patterns, lesions, and edema. So then, using the back of your hands, check the temperature of the leg. From feet up, it should be warm and asymmetrical. So now, flex the patient's knee and compress the half cuff against the tibia. Release the pressure and then the dorsiflex of the patient's foot. Neither action should cause pain. Do you feel any pain, sir?
No.
So next, palpate the peripheral pulses in the legs. To palpate the femoral pulse, find the artery halfway between the symphysis pubis and the anterior superior. So compress it and release it slowly. So the pulse should gently tap against your fingertips. So to locate the popliteal pulse, bend the patient's knee and feel for the pulse in the popliteal fossa. So next, palpate the posterior tibialis pulse in the groove between the medial malleus and Achilles tendon. So next, palpate the posterior tibialis pulse in the groove between the malleus and the Achilles tendon. So assess the dorsalis pedis pulse by palpating lightly. Lateral to the extensor tendon of the great toe. So check for edema by pressing over the tibia or medial malleus for 5 seconds and then releasing the pressure. Normally, the finger does not leave an indentation or pit. If it does, grade the pitting on a scale from +1 or mild pitting to +4 for several pitting. So, continue to assess the legs by evaluating their sensory function as you did when you tested the sensory function of the arm. So, assess the patient's leg for light touch sensation, pain sensation, temperature sensation, vibration sensation, and position sensation. So next test is the patient's motor function by assessing his deep tendon reflexes. We don't have our reflex hammer, we will use a pen as our reflex hammer. So hold this. The next step that we will do is the Babinski reflex. Stroke the lateral aspect of the sole of the foot from heel upward. The normal response is plantar reflection with no toe fanning or grade 2 dorsiflexion. If any of the patient's reflexes are hyperactive, Check for QANOS, an abnormal pattern of rapidly alternating involuntary muscles contraction and relaxation. Lightly support the lower leg in one hand, the foot with the other hand. Normally, you should not see extra movements or contractions in the leg. So during the next part of the assessment, you evaluate the cerebellar function for the heel to chin test. Ask the patient to place one heel on the opposite knee and slide it down to the ankle. They should be able to do this in a straight line. So the next step is assess the patient's gait and gross motor function. Instruct him to walk 10 to 15 feet, turn, and then walk back towards you. So his movement should be smooth and coordinated. His arm should swing freely and he should turn without losing his balance. So now we will perform the Romberg test. So sir, can you close your eyes? Assess tandem walking. Have the patient walk heel to toe in a straight line. He should be able to walk in a straight line without losing his balance.